What's up, guys? Welcome to Governors Podcast with your host, Matt Trotrick, and myself, Peter Fendura. Hope you guys had a good day. This is a nursing podcast where we tackle hot nursing topics and current health news, one conversation at a time. Remember, guys, give us the follow. Check us out on Instagram. Check us out on YouTube. Download our episodes. We're here every Friday with you guys. Give us the 5 stars. 5 stars only. If it's any less, we don't want it. Just forget about it. Put your phone down. How's it going, Matt?
Doing good, man. Before I say how I'm doing, I just wanted to thank the community for listening and tuning in and messing with us and hanging out with us because we're growing. We see it in the downloads and everything. So we appreciate you guys and everybody on the gram. I am doing pretty good. I'm actually really feeling this episode. I'm in a good mood. I'm going to go choke somebody out later in jiu-jitsu after this episode. So I'm pumped, man. How about yourself?
I'm doing good. Got off 3 in a row, so I was hanging out. Had somebody pick up our extra bed here, so the room's free, clutter free, bed free. So open up some room. So Matt,
how's your 3 nights?
Huh?
How's your 3 nights?
They're okay, not bad. It's January, so people are getting sick. You know, they come in more sick than they usually do throughout the year. Usually January, February are like more of the sicker months, or usually more like December through February are part of the sicker months. So we have a handful of people pass away, and people are just sick. So it is.
And then hopefully in the next couple of weeks, hopefully we're not talking about coronavirus and death in the hospital, man, because it's something that's could be potentially a pandemic as there's more cases in the United States.
Yeah, I mean, I don't know. Well, look at all the other things that they said was going to be like really a pandemic or an epidemic or whatever the proper term is. Like swine flu was supposed to be huge, and these other flus that are supposed to be huge, they really didn't turn out to be anything really substantial. But like, you never know. It's crazy because it's spread, and there's actually one case in our hospital. It was a rule out. I'm not sure it was positive or not. I'm at home now, so I can't really check, but I also work tomorrow night, so maybe I'll find out.
We shall see. I know in California they're slightly growing. But today we're going to talk about patients, the families, the good and the bad, why families could be a benefit to most of us, or some it might be a nightmare on your shift because they're so needy and things like that. So that happens. And we're also going to talk about the current health news, which is we're going to talk about vitamin D and its importance in our system.
That's correct, Matt. So vitamin D, it's a fat-soluble vitamin. It's different from vitamin C because I know we talk about vitamin C in one of our episodes. Vitamin C is water-soluble. Vitamin D is fat-soluble. And it's important for us to grow a healthy skin, healthy bones. It packs our immune system. It's a vitamin, guys. So a vitamin is something that you, I guess, you would ingest vitamin D. It's not active in its a regular state where you get it from the sun or from food. It actually gets activated once you digest it, and it gets activated in your liver. And like I said before, this is very important with bone growth and tissue growth and skin growth. Because as nurses, we all know that we need vitamin D to absorb the proper amount of calcium and phosphorus, and that's what kind of stimulates our bones to grow.
Also, for those patients that are getting older, naturally what happens is we lose the calcium deposits, right? So we need more and more vitamin D. Especially if you're more up north, we talk about like the winter blues, right? So I wonder, I'm sure there's a correlation between maybe depression and vitamin D, but nothing is linked directly. And vitamin D, we don't have enough research on it yet. But let's just say we talk about the winter blues, how people get more unhappy, get depressed. It's interesting how in winter we need more vitamin D. So it's a perk if you live up the warmer climates.
And there's actually 2 types of vitamin D. There's a vitamin D2 and vitamin D3. And if I'm not mistaken, the vitamin D2 is derived from plants, and vitamin D3 comes from the sun. So you go get sunshine, you go outside, the sun hits you, the radiation. I'm not sure what kind of rays those are. I'm not sure if is the sun gamma rays. I'm not sure if they're gamma rays or not. But the radiation from the sun causes you to develop vitamin D. And it doesn't really matter which form you get it from because they both get absorbed and then they get turned into a different active vitamin D in your liver. So both vitamin D2, the one you get from plants, and vitamin D3, the one you get from sun, they both get absorbed and they both get turned into this active vitamin D in the liver. And since we're on the topic of bones, so when people are deficient or when kids are deficient in vitamin D and their bones don't grow properly, that's called rickets. And then in adults, sometimes vitamin D deficiency causes a weakening of the bones in adults, and that's osteomalacia, I believe it's called. Yeah, osteomalacia in adults. And those kind of are like the main things that we've probably heard from poor diet or lack of vitamin D in our system. And then you were talking about the winter blues, and that's true because especially for us night nurses, like we work when it's night outside, so we don't get any kind of sunlight when we're working. And plus, when we go home, we go to bed, so we're lacking that sunlight as we sleep as well because we have blackout curtains. We don't want the sun in our room while we're sleeping because that's gonna wake us up. So night shift and vitamin D, there's definitely some kind of correlation between those two because we're definitely not having it absorbed by our skin and by our tissues, and we can only get so much from our diet.
And it's kind of interesting because the way we were created is we are meant to be up during the day to absorb this natural fuel. What if it's like a super nutrient that we're going to find out in the future that we should have been taking? And like currently we don't have like guidelines that tell us exactly how much you should be taking. Like the government recommends 400 to 800 international units. So that's like 10 to 20 micrograms. But there are studies that are saying you need 1,000 to 4,000. So it's like we don't have a clear definite, but we definitely should be taking it as a supplement or getting enough sunlight because it is linked to potentially less cancer and less bone fractures and some other things that like heart disease. It's saying our like US government is not saying it's directly, it's preventative because there's not enough study to back it up. But I think there's a pretty good correlation.
So the main, so when we think of vitamin D, the main thing we think about as individuals is usually bones, calcium, phosphorus. But I think it was like the 1960s or 1980s, a scientist actually discovered that vitamin D also plays a role in immune cells. Certain T cells and certain B cells have an adaptation for them to attach to vitamin D, and they use vitamin D to function properly. And over the years, studies have shown there's a correlation. It's not a really big correlation, but there's a correlation between vitamin D deficiency diets and vitamin D deficiency levels and Crohn's disease, IBS, and even cancers, and even lung capacity and lung diseases.
Wow, man. It's a super nutrient, guys. I think we should be consuming it possibly. I kind of wanted to find out. It's kind of funny because I went to the doctors and I got my vitamin D level checked, because I was thinking that I could be deficient. Maybe I'm more tired during the night shift after 2 years. I didn't find anything. It says my levels are good. What the problem is like, I wonder what kind of scale they were using to tell me if I'm good in like the percentage, because I think in Canada, they say you need 75 nanomoles per liter. I don't know what the American standard is. And I wonder how they were using that as a medical, what is it called? As an indicator if I have low vitamin D deficiency. So honestly, I might look back at it when I'm back in Chicago.
Do you know if they look at your vitamin D level, or maybe they look at your calcium and your phosphorus levels? And when they found that the calcium and phosphorus was normal, they figured, hey, your vitamin D must be normal as well.
See, I actually asked for vitamin D test itself. So I looked at it and I just cannot remember the lab value. I'm going to definitely check back and I'll let you guys know about it.
Yeah, because I'm not sure if my doctor, because they don't do it on a routine panel, right? Vitamin D, I don't think so. But there's patients, but there's patients in the hospital that get a vitamin D. I think it's an injection that they get, or I don't know if it's a pill. I'm not sure, but they take it like every 2 weeks, I believe, if the patient gets it. But I know there's some kind of a vitamin injection that they could give in a hospital, but I could be mistaken. I think that patient might have had a pill version though, but he takes it every other week. And even myself, I take vitamin D. I'm not sure how many milligrams it is, but I do take a daily vitamin D just because I work nights and I don't feel like I get exposed to the sun as much as I should.
I was taking supplements for a little bit of time and I kind of fell off. You know how you like order a bottle of multivitamins and then you just stop taking them and you don't reorder? That's the habit I got on. So maybe I should just tell Alexa, or I should have like a subscription service where they just keep sending it to me to stay on top of it.
Is it because you forget to take it, or you just forget to reorder it once the bottle runs dry?
The bottle runs dry and I just throw away the bottle. And then Matt's like, oh, I should need some vitamins. And here we are thinking about this idea.
Yeah. So for me, I sometimes had an issue with forgetting to take my vitamins. So I just put them right to my nightstand, where my phone is on my nightstand. Because I usually have like a beaker of water before I go to bed, and I leave it there. And usually when I wake up, I put my vitamin container is next to that beaker of water. So when I wake up, I know to take them. Because I know sometimes when I'm in a rush, if I wake up late or I'd say I have stuff to do, like we sometimes neglect not taking sometimes neglect taking the vitamins, and we kind of just skip them over just because you want to save the extra minute, or you just forget. So like right from the morning, right from the get go, I just wake up, take the vitamin, and then I'm set for the rest of the day.
I might get into that kind of habit. I'm gonna buy a supplement today, and I'm gonna put on my nightstand.
Do it today, huh?
Tonight. So let's talk about patients, right? Let's talk about families and how they could be a benefit or a negative to us. So, all honesty, Peter, when you hear of the word family for a patient, do you associate it negatively or positively?
To be honest, I probably associate it with it negatively. Like when someone says, "Yeah," and their family's here, what comes to my mind is, "Damn, I hope they're cool," you know. And usually, when a family is nice, the nurses would say, "Yeah, the family is here, but they're really nice." You know, when they say, "But the family is here," and they don't have anything after that, then you kind of know you're gonna have a little bit of a struggle today.
I feel the same way, man. Sometimes it could be a blessing, especially when you're getting a history and they're involved in care in a positive way. They're helpful. They understand. They have courtesy. Sometimes I feel like patients or families could be overbearing, and it creates a problem. Like even to the point where sometimes the patient is a lot more calm when they're alone and the family goes home. And then when the family comes and sees the patient, they literally have induced anxiety from them, or they feel overwhelming. You can tell on the monitor sometimes they have a higher heart rate. Like it's crazy, like how all these things work and whether it's positive or negative depends on the outcome.
When a family is there and they're, like you said, positive and they're helpful, that's like such a good thing to be around, because you could have a conversation with them. You could talk to them how their day went, what do they do for a living, and you all get along. And when you have a family like that, you want to also include them in the actual care, because most of the time when this patient leaves the hospital, who's going to be doing the dressing change for him? Probably the wife, the husband, the daughter, the cousin, the aunt, or whoever is there. So you want to include them in their teaching, and you want to explain to them the same thing you're explaining to the patient. You want to make sure that they're as knowledgeable as a patient, because like I said, they're the ones going to be taking care of them, and they're the ones that are going to be actually going home. And it makes a good environment. Like you said, sometimes when the family is there, the patient is stressed or a little on edge. Like I had a patient last night that when she was talking to somebody over the phone, like she had a few runs of VTAC, and she didn't have that when she was off the phone. And she had that twice for me overnight, like maybe 7 beats, which is not really that big of a deal. But she had that twice for me, and both times, like she was talking to somebody on the phone, and that was pretty interesting.
Yeah, like that's one cool thing about the ICUs, because these patients are always hooked up to the monitor. So we could literally, if as a new grad nurse, you're probably gonna like see that less. But now that you kind of know everything, you're less task oriented. You can see when a patient gets pissed about a family member, and that affects their mood. So they have a shitty mood for one. Sometimes they take it out on you, but you do see that change in the vital signs where their blood pressure is higher. There's times that I had to give somebody hydralazine to lower their blood pressure because they are pissed about something that's outside of the hospital, but their thoughts create their emotions, and they're pissed, man.
Especially if you have like a mid-30s, mid-40s patient that has younger kids outside of here, and they spend a lot of times in the hospital, like, because the patients that I deal with, they're recurrent, and usually they're there for a while. And some of them are in their 30s, 40s, and they have these younger kids outside, and they're stressed about their younger kids because the dad spent most of their time in the hospital, and there's really no father figure there to kind of put the kid in line. And and it's kind of like, you hear about those stories where a person that have a good father figure in their life, and they turn to doing bad things, turn to doing drugs, and just being not complying by the law. And you kind of see that. Like I ask my patients, like, hey, if they're okay, and they're like, they would vent, like, man, I've been here maybe for 8 months out of the year, in and out, and then my kids are not getting good grades. I don't know what's going on. I can't really control it. I'm sick. I'm on, like, I can't go home without medications. I got to stay on this Primacor and the Butamine for my heart, and I can't really see my kid, and he's doing bad in school. And you kind of like damn, that gives a perspective. Like that really sucks. Like that kid is literally has a lack of a father figure, even though dad wants to be there, he literally can't, or he's going to die. And it's very sad to see, and very sad to deal with.
Damn, man, that really hit home, because I really don't have those as sick patients when it comes to like the hearts. But wrapping things around because I wanted to kind of circle back regarding how we see hemodynamic changes based on how the patient feels or the family. It's funny how today I went to go get like a toxic drug screen, and I had to get fit tested for the N95. Well, my travel company never sent an N95, so they were about to tell me to reschedule because I didn't have a fit test mask. Luckily, I talked to the supervisor and I got away with it. But initially, he told me that. Then he checked my blood pressure and it was in the 150s. And I don't want to have on my physical to have hypertension. I need like pills, right? So I'm like, shit. So he was supposed to recheck a manual. I'm like, hold on, sir. Like, give me a couple minutes because my emotions are literally just kind of, I just got pissed. I had to kind of take a couple of deep breaths, Matt, freaking meditating a little bit. So took a couple of deep breaths, rechecked, it was in the 120s. But it's crazy how like families could affect you like that in a negatively way.
Yeah, like your subjective thinking affects how we see you objectively as a patient. Like it's crazy how that all works together. And that's like the whole mind-body connection. We're one giant living organism that function as a whole holistic individual, and everything impacts another thing. So what do we do when these families are just not compliant? We just don't get along. So what I usually do first is try to clear up what actually is going on. So why is a family member acting this way? Maybe they're upset because they're not getting enough education or they're not getting updated on what's going on. The nurse comes in, gives the meds down the peg tube and just doesn't say anything about the medication, and they're frustrated because they're not sure what kind of medication they're getting. So you kind of have to figure out why they're acting the way they're acting. Why are they upset? Why are they angry if they are angry? Sometimes they don't want anything. They're just a bunch of assholes, and that's just the way things roll sometimes. And sometimes you just got to deal with it.
Yeah, low key, man. Sometimes there's just family members that are assholes. You kind of really set it point blank, period. And one little tip I feel like maybe that people should know. One thing that really irritates me is when the family member runs into the room when the patient is getting, like, let's just say, admitted to the ER. Like, a lot of people don't know that, hey, we're about to transfer them. There's about to be a lot of people in the room. We're going to wash her up. Like, we're doing things that, like, just step aside a little bit. And most of the time, I'm not a nurse that gets stepped over. I usually tell a family member, hey, like, we're going to need you to step out for a second. Can you wait in the waiting room? And I'm going to get you when the time is right. Then you have family members, when we're putting a central line in, they don't freaking listen. They come in and they're just in a way. Or I'm like, hey, man, we're not done yet, okay? Or they try to walk into the room, hey, man, there's an x-ray coming in 2 minutes. You're going to have to leave again. Like, they just don't. I wish they respected us a little bit more during, that phase.
And how you have helicopter parents, you also have like helicopter family members, like Matt was mentioning, it's just like always hovering, always there. And if you really don't get along with them and you're really feeling heated, like, you're very angry, very frustrated, and you just want to explode, the best thing you could do for yourself is definitely just leave the room. Say, hey, I forgot a flush. Let me be right back. Hey, I forgot this. I'll be right back. And just leave the room and just kind of take a few deep breaths, walk around a little bit, and try to, let those emotions subside, because there's no reason why we should be exploding or yelling at the patient's family members in any sort of way. It's hard sometimes, but it's not very professional. And if you and the family is not really agreeing on the plan of care or the care that's being done, talk to your manager. Have them step in, have them talk to the family, because you should not be arguing with the family or anything like that over care.
Yes, and that's one tip too for you guys, is to, if you have family members that are like unfocused with what's going on, they're arguing, like, help them focus on the patient. And that happened with a patient that was on life support. The mom basically filed charges with court that the father can't see the son. But end of life care, we actually called the father to come in. They were divorced. They're literally arguing with each other that this is their fault in the freaking room while the patient is on pressors, while I'm hanging drips. So like, the charge nurse asked the supervisor to come in, and they said, hey guys, so this is patient Susie Q on her deathbed. Like, let's just focus on the patient, as there's angels around her in this time of death. Like, cause he died the next day, man. So like, sometimes you do have to just put focus, because that patient needs to be in peace when they're literally dying and you guys are arguing. So there's like some shitty times that like it happens. That's like, it's messed up to see, man. But we do see that side of healthcare.
You could also call like a code gray. I'm not sure what color it is in your hospital, but for us, it's code gray. And you could call that when a family is really being disruptive and really arguing with each other, just being loud, and you don't really know how to handle the situation. Call it code gray. They'll bring the police officers police officers up there, and then probably a behavioral counselor or somebody that's going to help you in a situation. Because even though you might not be the source of the problem, the family might still take it up on you. And last thing you want is somebody screaming or yelling in your face, or worst case scenario, you getting punched by somebody or pushed or shoved. So don't be afraid to call that code gray. It's not gonna hurt you in any type of way, because you can't just provide a good patient care while the family is being unruly and aggressive toward each other. That's completely taking away the care from the patient and putting it on a family. Like there's no sense of doing that. Like your family member is in a hospital. Let's focus on him. Like you said it, like I could have said it any better myself, where you said, Susie Q, it's on her deathbed. Like there's angels around her. Let's focus on her. And there is times where I've actually been really angry with family. And of course I couldn't really do anything about it. So what I do during that time when I'm like frustrated, angry, is I focus even more on a patient. So I tend to kind of, I don't want to say ignore, but kind of tune out the family. Because sometimes they would be making like random comments, just trying to get you a little frustrated, but they're not really asking any kind of question. They're just saying random things. Just try and tune them out and just focus on a patient. When you talk to the patient, you give the patient eye contact, and just I guess you would say ignore a family member, but you also want to answer their questions just because you don't want to be rude. But when they're saying these random comments, you don't got to take part in that at all. Just try not to hear it.
I'm actually remembering a story that was like very disturbing for me when it comes to like, so we're talking about families, how to properly deal with them. There was a weird family member and the son was super, super involved in her mom. Like what creeped me out is like, I'm wiping the patient's butt and like, he just circles around. Like if you guys are on YouTube, he's kind of like looking and he's kind of like stepping in. He's like, oh, we're talking about her poop, And I'm like, I just felt a little bit uncomfortable. Like he's just so like involved. He's smelling the patient's poop. Like while I'm like doing the care, I'm like, what the heck? So like the next time I'm just like, hey, the patient's in pain a little bit. Do you mind stepping out for a second? I felt like there had to be a little bit of a boundary I had to break because that was uncomfortable for me.
Yeah, there was also a time for us where it was a gentleman, I think his daughter or stepdaughter or somebody, and like every time he was there, he would linger, like you said, the guy that you dealt with, and like it just seemed off. Like she would act different when he's around. He's super involved in this care, like there during all the baths, just walking around, taking a look, looking at everything, and just kind of making these weird remarks. And you kind of could, like, your instinct is almost telling you that there's something definitely going on here outside of hospital. There might be some abuse or some some harassment or some sexual contact going on that's not really appropriate. But, like sometimes you just, as much as you want to say something, you really can't. You got to wait for the guy to leave or whoever that person is to leave, and then try and talk to the patient about it. Be like, hey, are you okay with him being here with you during the whole hospital stay? You're okay with him being here, while we wash you up during the bath? And, this lady said that everything's fine, but we kind of suspected that it wasn't. There's nothing we could do. If the patient says like it's fine, let him do what he wants, then you can't really do anything about it unless you actually see some neglect going on. And it's very sad to look at that. Then kind of you feel powerless, you feel weak. Like in clinicals, we had those shaken baby syndrome babies where it's usually a cause of abuse, where the mom or dad takes the infant and just shakes it, and then what causes a fracture of their C vertebrae, C spine, C vertebrae. I'm not sure if it's one or two or which one it is, but that infant is basically paralyzed. It's never going to move again. It could breathe because the brainstem is fine. It's just everything below the C section, the C spine is completely flaccid. And you know that these injuries are caused by abuse and neglect. And before the state gets involved, guess what? The family's going to be in there. They could hold the kid. They could do whatever they want because state hasn't got there yet to intervene. So imagine being in that room with the infant that's now paralyzed for life. Is probably gonna eventually die in the next few years, maybe even less, knowing that the family did this, and the family's there crying, so sad, holding on like they don't know how it happened, but you really do know how it happened. You know how it happened because a lot of times, majority of the times, like 90% of the times, these injuries are caused by neglect, by trauma, by the kid being shaken, because sometimes babies want to just cry and they won't stop crying, and the family does not know what to do, so they just shake them to get them to stop crying. And it's very unfortunate to see that happen. And you got to be in that room completely okay with it, like ignoring the fact that this is due to abuse.
It's kind of fucked up that you mentioned a story. Like, it's sad that this kind of like stuff happens. And just one thing I thought about that gave me a lot of perspective is working med-surg to ICU, right? So being in med-surg, I seen a lot more happy families, a little bit less like cases like this or emotional, psychological abuse, just dysfunctionality, like mental health things. So like jumping in from med-surg, patients are a little bit more happier, a little bit more thankful when you left because they're more talkative. And when you get to these sick patients with a lot of comorbidities and they're usually mostly unhappy with their life, like you see a lot more of these effed up stories. So we are more surrounded by negativity if you think about working ICU compared to like other nurses.
And it sucks. And it takes a toll on us. It takes a toll on us, on the patients, on the families. And that's one thing we go through as nurses.
Right, guys, and like, I also wanted to mention like boundaries. So like you definitely have to set boundaries, as messed up as it sounds for people that are like not in healthcare listening to it. Like we get walked over as nurses, man. Sometimes you got to put the foot down. And I love to do it whenever a nurse gives me like a hard report that says like, oh, this family's A, B, and C. I'm like, sometimes maybe it's my ego. I'm like, oh, don't worry, I'll take care of it. Because we have those times where hey, like, let's talk to the side. Let's go on the side. We whisper little things that happen with the patient and stuff like that and the family. Like, I love those challenges sometimes because I kind of handle the family well. I don't know if I set boundaries, but that's one of those things. Like, if there's like 6 family members, I'll limit it. Like, if the family like gets in my way, I'll say, hey, listen, I'm delivering care. Let's just do 2 visitors. And I sound like a dick, but at the end of the day, I have to do things which is best for mostly my patient and then also myself, because I have to get my job done. And there's those overbearing families. So it's not black and white in nursing, right? We don't know what's too much, too little, but you set a boundary as a nurse. So definitely don't be afraid to do that, because patient families can be taxing, but they also could be rewarding. And that's the beauty of healthcare, where we walk in every day and it's a challenge with patients and the family.
In nursing, in general, nothing is ever black and white, especially in healthcare. And it just never one side to the story. So when you're dealing with family and the family is I guess, when you're dealing with family and the family is helpful, be empathetic, involve them in the care. And there's those times where we are going to have those negative family members. You always have the option of calling a cold gray if they get disruptive. But also you kind of want to figure out, why are they angry in the first place? If you're feeling heated, angry at the moment, try to step out, relax, because you shouldn't be yelling at the family members. And like Matt said, you have to set boundaries of what they could do, of what they can help you with, and just the way you talk to them and what you allow to them to say to you.
I love that summary, Petey.
Yes, sir.
Let's wrap this one up. So guys, thank you for listening. If you guys are messing with us this long, a little secret, guys, follow us on Instagram, comment. We love interacting with you guys. Send us a DM. We'll send you guys a video reply. We're doing a lot of community stuff. So check us out there, and we'll see you guys next week.
And don't forget, Patreon coming soon near you. Have a good one, guys. Peace out.
Bye.